Travel nursing can bring you to places you've never been before. Tell us your story.
Hi, everybody. It's Rita at the Hello, let me start again. Hello, it's Rita at the Travel Nurse Channel. And I did not change my title, but I thought it's Thanksgiving week. People are already, I'm a little blurry there. People are already thinking holiday. Some people have started the holiday off. It's not healthcare. Healthcare is 24/7, 365. But there's that feeling. Traffic was lighter today. People are planning a 4-day weekend or more. Some people are taking Wednesday through Sunday. People are doing more festive things. They're shopping and they're going to events. I went to an event last weekend. That's visiting San Diego, and it's a representation of Michelangelo's Sistine Chapel. And instead of having to look up at the ceiling with millions of other people in the city of Rome and the Vatican, we got to do it in San Diego, and it was pretty special. It was pretty special. Anyway, so today's topic, nursing values, and I had hoped that we would be speaking with a guest speaker. We will be, just not this day. And but nursing values and the holiday made me think to speak about what we're grateful for, who recognizes nurses, and some of that. Excuse me a minute. I got itchy nose. I'll use my scarf. Let me open the comment line. This is a live broadcast. This is the Travel Nurse Channel. We are a venue and a conduit for everything to do with nursing and travel nursing. We are a place, our clients and our benefactors and supporters are people in that industry. People that employ nurses, people that recruit nurses, travel companies, etc. I think we may even have a sponsor that provides uniforms. Everything surrounding the travel healthcare realm is what the reason that this is here. The reason that I visit every Tuesday from 10 to 11 Pacific Standard Time, or as close to 10 as possible. I apologize for being late. I'm going to interject something in here because you may not see me for a week or two. I was on a long conversation with the nurse at a hospital, and then in another conversation on hold, mostly for the doctor's office. I am going to have my hip replaced, my right hip. So you may all have known me once with two good hips. Here I am now with one not so good hip. And they say the other one looks good, which is really reassuring. So on Monday, the 29th, right after Thanksgiving weekend, I am going to have my hip replaced. And I was supposed to be the first surgery, and I was really excited about that. But I am not. So that was something I needed to clarify with both the doctor's office, the scheduler, and the people at the hospital. So yeah, it's 11 a.m. So that means that the next day I may still be in the hospital. I will probably still be in the hospital. They like to keep you overnight. And so I won't be on next week after Thanksgiving. And I'm not sure about the week after, but I am sure about the second Monday in December. And I hope to have a wonderful guest for you then. So bear with me. I'm kind of absolutely delighted and a little bit horrified that I need this, but I'm ready and I'm in good shape. November has been a much more comfortable month for me than probably the last 5 months. So that's good. That's a good way to go into surgery healthy and fairly strong. And so that's that little memo. And back to what we're talking about today. Today I would like to look at some things. I usually try to give you, 5, 8, 10. I'll try to give you more because we have time. But things that we nurses are thankful for. And there are many things. And I think it's a good time to focus on that because there are many things that are still difficult, that make our jobs difficult. And I was just reading a physician's story, and his story is, and he is probably more like me, started a few years ago, had a nice 20, 30-year career, and then wrote this book. And I should talk to him. Maybe he would like to come on. Anyway, but it was the time management issue and the things that we do in 2021 that we've been probably doing for quite a few years. The electronic medical records have not really kept us at the bedside. The charting, I mean, of course, you have to chart, and it's good to chart, and it's important to chart, but not to the extent where you're spending more time doing that than at your patient's bedside. And so this physician that wrote this book was lamenting about that as well. And he said they went from what are they called? Not scribes. People that would listen, they would dictate their notes, and then the transcribers would translate them into paper and so forth, into the charts. And then that went away. The electronic medical record came about, and then that was difficult. Doctors and residents and fellows and everybody working in hospitals were spending time after their shifts to complete that kind of digital charting. And the whole thing is a bit of a fiasco. Scribes were used at one point in the past, where volunteers or maybe college students trying to get into medical school and so forth, they would follow doctors around and scribe the notes, push the portable computer around, and it was kind of a good learning experience for them. But there's always issues with that. I think probably one of the things to hope for, and maybe are in use, I'll have to research that, would be voice-activated charting. Wouldn't that be wonderful? You're assessing your patient, and you could say to the patient, I'm going to be talking out loud as I speak to you, because this way the charting will get done and I can stay with you at the bedside a little bit longer. And so you could be doing your assessment. Say, I'm here with Mr. Jones, and he's alert and oriented this morning. We're going to talk about his pain. He was admitted, for gallbladder, whatever. And you could be voice activating your charting right then and there. And I'm certain, I am absolutely certain that I toured a hospital in the 90s that had just been renovated here in Southern California. And they had these beautiful, there were squares at the bedside that were about, 15 inches by 15 inches square. It had a big keyboard, so patients that maybe had blurred vision or didn't have their contacts in or their eyeglasses could use the telephone easily. There was a big red call, panic button, and there was an ability in that system to dictate at the bedside. And voice activation charting, to me, I would love to see that working. Anyway, so it's not perfect. It's not a perfect system. It's been a difficult, many, many months, way more than a year now since COVID. And some of the issues that have been issues for a long time are still there. The good news is that we're working on it, that leaders and leaders of hospitals, leaders of nurses, nursing leaders, nursing professors, everybody is trying to work together to make things better. Excuse me. I'll take a sip here. I'm carrying my Joy cup carrying my joy cup today. I often, I have a Disney cup that my grandbaby and I like to go through the characters on it. So Mickey and Minnie and Donald and Daisy and Goofy and Pluto are all on the cup, as well as the Disney castle. So that's my usual cup, but today I'm carrying a joy cup. And I will tell you at the top of my list of what is a blessing in nursing, what I am grateful for in my connection with as needed nursing, travel nursing, counseling nursing, managing nursing, clinically nursing, all of that. One of the top of my list of what I am grateful for is the honor it has been to care for my patients and their family. That makes it all worthwhile. No matter how disturbing a day has been, no matter how disconnected I may have felt in my many chores, getting through a 12-hour or an 8-hour shift, disappointments sometimes in my team, disappointments in myself, emotions of difficult tasks and difficult diagnoses and so forth. Above it all, the most rewarding and the most grateful feeling that I have is the honor it has been to serve my patients. And so that is at the top of my list. So I have a site here. I have not really gone to it before, but when I looked up gratitude in nursing, this site came up, and I really agree with a lot of what they have to say. They have quite a lengthy list here. So let me see, number 1. This is great. And who is the author of this? Let me tell you who the author of this is. It's called Nurse Slabs. And it was updated. Oh, it hasn't been updated in a while. It hasn't been updated in a while. Maybe we don't want to go with this list, but the first few that I looked at, I will, it just rang true with me. Let me go to the end of the article and see who the author might be. Huh. Oh, so there you go. There's a picture at the end of either a nurse or a therapist, and then you can see in the background another nurse and another patient. And underneath the photo, it says, "A nurse's sense of fulfillment comes from her patient." And that's kind of what I was saying. I am very, very honored for the patients that I have taken care of over the many years of my tenure of, oh Lordy, 87, 97, 2007, 2017, 40-something years as a nurse. It's unbelievable. I'm so old. Anyway, I will give you some of the working rhetoric from this site because I think it rings true. It rings true in 2021. This is a few years ago that it was compiled. And it says it's the Emery Rose. No, that's something else. It's Nurse Slabs, whatever that is. Nurse Slabs, it's just a list, and I will share it with you. It starts off by saying, working as a nurse isn't easy. The hours are long and exhausting, and it's easy to miss some of the little but valuable things in life. Like many of you will miss Thanksgiving dinner, whether it's at lunchtime or dinner time, because you're working either day or night shift. It doesn't mean that there's nothing good about the profession and that there's nothing to be grateful for, because there's much to be thankful for. And we may not get bonuses like people in corporate jobs or, other areas of the employed world, but they made this list of things to be grateful for. And I do agree with a lot of them. Number 1, you know more than a dozen ways to save a life, from CPR to drug antidotes. Nurses are skilled enough to help keep their patients living. Okay, that's good. That's good. I like that. Okay, 2, there's always room for improvement. If you feel stagnant, you can always go back to school to learn more. Good one. Patients trust you with their stories. It doesn't matter if it's a sad, a happy, or an embarrassing tale. The idea that your patients trust you is already a big deal. Yes, most of them do. Most of them do. You have to work pretty hard with some characters. So, and of course, we always, I don't want to get sidetracked with all my stories, but I expect to see when I was at the bedside or visiting homes, doing home health, in any situation, that you do not see people at their best, and respect that. And I do remember a situation where a patient was very, very ill, and it was in the home, and his closest friends were there and family, and they were apologizing, and I'm like, not a problem, not a problem. They were very out of it, very, very sick, and that, you know, I was there to do whatever was necessary, and it didn't matter, because I remember them being so, the patient was just so weak and so uncomfortable, and I was trying to either get him in the shower or on the commode or in the bathroom. He needed the bathroom, and he just looked up at me through that process, and he went, "You are so stupid." And I went, "It's okay. It's okay. All righty. Don't worry about that." But the family trusted me, and the poor patient was just so sick. Okay, number 4. Nothing compares to the feeling you get once you remove your shoes after a toxic shift. Okay, that's a great thing. That's a great thing. And actually, I will add my own 2 cents to that, removing your shoes after a toxic shift. Now, that could mean there's blood all over your shoes, or it could just mean that so many rude comments were made, or you were pulled in so many directions, whatever made it feel toxic to you. But I will say, on the long shifts that I did over the years, the 12, 13, and sometimes longer shifts, that's something I did at some point. I always took some kind of break. It might have only been 15 minutes. If I was lucky, it was 30. But I either changed my shoes or my socks. So I either started with support hose and then changed into cotton socks, or started with cotton socks, changed into support hose, or knee socks or something, or brought an extra pair of shoes. So went from, you know, whatever, my earth shoes to my tennies or whatever. That little gift I gave myself of making my feet feel stronger and better and more comfortable for the remainder of my shift was always a bonus. So I get that. And just taking off all my clothes, including my shoes, when I got home was always a good feeling as well. Number 5, you'll never have a boring day at work. That's pretty much true. That's pretty much true. I want to add my own in here too. Right after my great honor, the blessing it is to have cared for the patients I have cared for over quite a long career that started in the 70s. Right after that is the ability to be able to laugh with a patient, to laugh with a cohort, to laugh with a fellow nurse or a doctor. That has always been a great thing, because you're dealing with such intense things, you know, people's difficult diagnoses, pain, horrific, you know, traumas, just so many things like that. So to be able to find laughter in a day filled with so much intensity, it's always been a wonderful thing. So that's my number 2. And now our number 5 on nurse slabs that I'm sharing with you today. By the way, the comment line is open. We are live. And anybody that is interested in chatting can do so right now. And anybody that is interested in being a guest, that can be arranged as well. I'm now looking at a lot of authors that have a lot to say about nursing, travel nursing, different areas of nursing, Um, you are all so important and have so much to share. People that work in healthcare, the recruiters, the companies that employ nurses and therapists and technicians and physicians, everybody has a piece to this travel healthcare world. I use nurses because I am most familiar with nurses and because they are a huge part of that healthcare workforce, and particularly in travel. And but I welcome you all to give me a call. The number's up there, 800-737-6518. Call anytime. I usually broadcast on Tuesdays live on the Travel Nurse channel from 10 a.m. to 11 a.m. But we can broadcast anytime because all of these episodes that have been going on for quite a while, many years, are live and archived. So if you want to talk about rates, if you want to talk about prepping for an interview, if you want to check in about the different companies for travelers, there's so many. There's well over 360 companies out there. Some cater more to convalescent long-term, some cater more to critical care, some are broad and employ some of the big companies, the cross countries of the world, the IAs of the world. Those big companies cater to a variety. So it's just whatever suits you best. If you're an LVN, if you're a nurse practitioner, if you're some kind of specialist, you might want to seek a company that works primarily with your discipline or your genre. If you do maybe oncology, you like clinic work, if you do case management. So there are companies that really focus on those things. And there are companies that really focus their travel on a couple of states. It might be the Western Seaboard or the Eastern Seaboard or the South or the North, or Hawaii. So there are companies that are specific to what interests you and where your specialties lie. And there are companies that are bigger and broader. And there are small companies and big companies and radiology companies. So there are a variety of travel companies. And I welcome any and all of you to come talk about what you do and how it works for you and what your nurses have to say and what your travelers have to say, because other people are interested. So let's get on with my list here. You'll Never Have a Boring Day was number 5 from Nurse Slabs. So this focus today, the title is not exactly where we were headed today, but it inspired me to talk about gratitude and what nurses are grateful for. And I found this list. Number 6, there are a lot of machines that make our work easier. IV pumps are an example. There's no need to count and recount the number of drops anymore. Okay, that's something to be grateful for. You get to poke people with needles. The more fun part is that you get to decide what needle size to use. Okay, this list is getting on my nerves now, so I'm going to skip over a few. Oh, I think this is a good one. This is number 8 on their list. Being a nurse means you're in constant motion. There is a lot of activity going on for nurses, regardless of the setting. You have to go back and forth to get meds. You have to use your muscles, work, reach, stretch, bend, whether you're at the bedside, whether you're in a clinic, whether you're in a long-term facility. There's a lot of motion going on. Yep, lifting, running around. Yep, that's true. That's true. Put on the miles. My friend who recently retired, my dearest friend, as a respiratory therapist, used to track her miles sometimes, and she would always use the stairs, and she worked 12-hour shifts. She went from 8 to 10 to 12 over the years, and she put on a lot of miles. Okay. The moments of silence can feel like a little bit of heaven. The silence you experience once you close the car door after your shift can feel like heaven. with all the bells, with all the buzzing, a moment of silence is a rare gem. Oh, that's kind of a nice thing to be grateful for. I like that one. Okay, they gave a caveat to this one. Doctors listen to you. Of course. Of course, we're critical thinkers. We're at the bedside for hours and hours. But then the caveat is they can also argue with you. Well, you know what? If it's, that's okay. That's okay. Arguing doesn't mean fighting. Points of view. So maybe you thought of A and B, and then the doctor points out C. So that's okay. That is okay. So being listened to is something to be grateful for. There's some pictures here. It just shows nurses moving down a hallway. I can't see the writings too. Oh, the picture is the senior resident listens to a nurse. Listen to nurses. Okay, whatever. I don't know. That's kind of odd. I'm going to skip that one. Oh, it's a secure job with tons of subspecialties. That's true. That's true. I like that. Yeah, informatics. We've talked about that before. RNs that turned into informatics specialists. As a matter of fact, I've contacted somebody to see if they would be a guest on the show because I'm so impressed with that. It's so important. And we need the help of informatics. We need to grow and see how we're going to improve going forward. And so having all the informatics in is going to be so important. And we're all using computers. We can't live without them. I couldn't be here talking to you this way without one. Let's see. We don't have to wear high heels and tight skirts to work. We get to wear comfortable scrubs. I like that. Oh, then the caveat there is it's the nearest thing to pajamas. I love my pajamas. You get to make a difference in people's lives. And it's a great honor. I agree with that completely. Blood doesn't make you feel faint. You have family and friends who don't get mad at you for missing important dates because of work. My daughter's going to miss Thanksgiving. She's almost to the end of her OT program for occupational therapy, certified occupational therapy assistant, and she is going to be working Thanksgiving. And I said to her, welcome to healthcare. It's a 365, 24/7 occupation. Patients respect you and listen to you. Although they can be difficult, most of them do listen to what you have to say. Okay, this is not, we've gone through about 10. I welcome anybody who's live watching right now. If you have anything that you want to share that you are grateful for, maybe not grateful for. There's always the yin and the yang. Seeing your patient recover. Perhaps there's nothing more rewarding than seeing the person you've cared for and attended to for days get well. That is a nice one. Yeah, yeah. And that's that. So that's that. Gratitude in nursing. You know, we have now all these Hallmark holidays, and it's invaded the healthcare workplace. And so we have Nurse Week and Respiratory Therapy Week and Radiology Week. And I know because when I had my own nursing agency and I worked with hospitals, I would want to show gratitude. And so I always brought in, you know, luncheons or breakfast or gifts on those Hallmark holidays. But it is nice to be recognized. And when it is Nurse Week and Nurse Day and whatever, specialty respiratory therapy and Physicians Week and so forth. I don't know how many there are anymore, but that's when you hear the nice things. And during COVID, when my friends were all working, they were like, enough with the lunches, enough with the pizzas. They're like, what they really need, they weren't getting. They were frustrated. They were frightened. They were overworked. They were devastated by the not just the number of deaths, but the horrific deaths that were occurring in the hospitals. And they needed, they really, my friends that I talked to that were still actively working through COVID, they didn't have enough equipment. They got different, they said it was like every day there were changes. I thought I turned this off. Anyway, so what they would have been more grateful for, I hope that is evolving. I know that nursing leaders, there are groups and organizations and clubs, and within the hospital there are teams to look at what is best for staff retention, for the health of the staff and so forth. I remember when I wasn't even on staff. I was outsourced, and I was helping out in interventional radiology for a couple of years. It was a great honor to do that. And it was a interventional radiology, cardiac cath, pre and post procedure setup in a relatively smaller hospital, but part of a bigger group of hospitals. And I worked with a lot of talented staff, doctors, nurses, techs, and they did a lot. HCAPs were in place when I was there back, I want to say, between maybe like, trying to think, 2009 and 2016 or so, somewhere around there, that they had regularly, I don't think it was just during Nurse Week or special times, they regularly had, maybe once a week or twice a month or whatever, they would have set up in an area of the hospital that had like a big corner area between offices and exam rooms and so forth. They would set up a therapist or two, a massage therapist with a special chair, and they would be there so people could take a break and go down and just sit and zone out and let their shoulders get rubbed and their heads and their arms or whatever, their lower backs. And that was such a nice thing to do. They offered at that hospital too lots of education. Usually when they provided some education, they provided a meal to go with it or a snack to go with it, because it is a busy time when you're taking care of patients, and you can't go off track for too long. Things are just constantly being scheduled. Patients need a lot of assessment and reassessment in many areas. So you can't be away from your patients for long. But I think during COVID, there was so much effort to do things right, to keep the staff healthy, to save the patients, that the trauma of what was going on, particularly with the healthcare workers, was not being addressed. And I know I'm always trying to stay centered. I somehow move too much. But my closest friends that I talk to regularly were really quite traumatized and devastated and not feeling supported by their hospitals and their leadership. And so I know that I don't recognize that alone, that others are recognizing that. And I hope that inroads are being made to improve on that. So the Cleveland Clinic, I actually have gone to their site quite a bit. Let's see what they have to say about, and if there's a date on their news here. Yeah, oh yeah. So this is from a recent Nurse Week, I think, May of 2021. and they have a beautiful picture of 3 nurses in scrubs, a guy and 2 gals, and you can see they look like they're in the hall of a pretty good sized hospital, like it's a wide hallway. And they say the past year has been challenging, but in many ways, nurses have emerged from the COVID pandemic stronger and better prepared for anything the future holds. The empathy of nursing caregivers. Nurses went the extra mile. Nurses and other healthcare workers, I have to say that because we were all in it together, right? Nurses went the extra mile throughout the pandemic to be there for patients when their families couldn't, offering a hand to hold, answering questions, staying by their sides so they wouldn't be alone. That is another reason to be grateful for our caregivers. Across the globe, nurses and other practitioners put their lives on the line to help fellow caregivers. We saw that in travel in some of the stories I brought to you that you may have seen on the news as well, of nurses coming out of their comfort zone and opting to travel, and to travel to places that were really, really suffering. New York City, for example, the state of Washington, a lot of places were in dire, dire shape, and nurses got out their suitcases and went traveling to help. So this this site, which is the Cleveland, what is it? The Cleveland Clinic, yeah. Caregivers who assisted healthcare colleagues in need. Across the miles and across the globe, nurses and other practitioners put their lives on the line to help fellow caregivers who needed it most. Caregivers traveled to Michigan, to New York, to care for patients at Henry Ford hospitals, New York Presbyterian hospitals. Caregivers from Cleveland also traveled to Abu Dhabi to assist Cleveland Clinic Abu Dhabi. And Abu Dhabi caregivers returned the favor in Cleveland. How nice, how wonderful. Donors, communities came together to the aid of healthcare workers. That's where some of the lunches were coming from some, groups and communities that wanted to do something and didn't know quite what they could do. I don't think I have all my lights on today. The outpouring of support for healthcare workers has been incredible throughout the pandemic. Donations, acts of kindness, inspiration, motivation, help keep them strong. To a degree. And I'm glad that this group, the Cleveland Clinic, felt the love. But I know many of people I talked to felt like they were just moving through molasses, trying to get through, not having the equipment, not having the knowledge, not having the support, just getting through shift after shift after shift. And every time that they weren't on shift, being asked for more and more and more. So, but on the leader side, I know the leaders, they can't help unless you communicate. So communication is huge on both sides. Nobody can fix anything if they don't know it's not broken. And the leaders were doing what they could to bring you the information, to bring you the equipment. And when you needed more, you have to ask for more. So there's that side of it as well. I think I want to use the word amazing. I think many of the people I worked with over the years, I thought were amazing. I thought it never occurred to them not to do as much as they did, to care as much as they did, to be as skillful as they were, and to be kind and forgiving to not only their patients but to their coworkers, to know what to do, to step in if somebody froze, to step in, to ask questions, to give of self, and be non-judgmental. Yes, there are other sides to that coin where people are judgmental, where they're not strong team members, where they're kind of solo operators. There is that side of it. But the other side is that there are a lot of amazing, helpful, supportive team members So be grateful for them. Ah, this is on my list. The ability to laugh. The ability to laugh. That's what I'm talking about. We can use more laughter in our day. Laughter can have a positive impact and deliver numerous benefits. Research like that featured in this article has shown laughter to help relieve pain, bring greater happiness, reduce stress, and more. Isn't that wonderful? Gotta laugh. You gotta laugh. They even mention in this article that the support of family, friends, and pets. And I remember actually, some of my shifts over the years where they had pet therapy and wonderful animals. I do remember the golden retriever, and they are a wonderful animal, but I remember other animals as well being brought in by their owners, and they would just lie on a bed with a patient, just lie there and just be with them. How wonderful, how wonderful. Multiple studies show that dogs can help alleviate stress and anxiety and help people cope with crisis. And I know another story, one of our nurses, I believe, when I had my nursing agency, a nurse that worked for me had a child with a terrible seizure disorder. And some organization helped her get a pet. And this it's an elementary level child, very young child, maybe 7 or something. The seizures went down. Huge drop in the number of seizures. This is a child that was having lots and lots and lots of seizures. Went down when she got the pet. Just love that. I love that. That I am grateful for. I hope that child is grown up and doing very, very well. There are a lot of pictures on the site from the Cleveland Clinic, so I can't share that with you. I'm going to have to figure out a way to do that. A lot of times, I'll hold up a board and share information in big print, but I don't have a board today. So, it is kind of gaining on the holiday time. Travelers, I hope that you share while you're traveling. Maybe a family member will come and spend the holiday with you, or maybe you will have made a friend and share a holiday with a new friend and their family. I remember being young and coming to California on my own with my one and only beautiful child at the time, Michael, and spending my first Thanksgiving with my sister's in-laws, and it was lovely. But I also remember my first birthday out here without my family and just my son. And I have to say, I had to be like 27 or something. And it was the first time I could recall not having a major birthday celebration or a cake. And I thought, how lucky am I to have gone almost 3 decades and had a birthday celebrated by people that love me. And it's not that anybody ignored me, it's just that I was far away. And it was back in the, oh my gosh, was it the 80s? Michael was born in 1980. Yeah, it was the early 80s. I don't think we were shipping cakes and breads and soups and all the things that we ship now. Back in the day, we shipped flowers. My mom couldn't bake a cake and ship a cake. God bless her. But my mom always made a big deal about all our birthdays. I don't think she grew up that way, but she did that with each of her children. She had 4 of us, and she always made a big deal out of birthdays. My one brother, my youngest brother, so I had an older sister. God bless her in heaven. And I will say I'm grateful for all the people in my life, here and gone. And nurses, I'm thinking of you all working so hard and not being always able to be with your families. I celebrated many holidays, not exactly on the holiday, because it was fun to do, and I wanted to do that with my young family at the time. But I babbled on, and now I forgot the story I was telling. But it's all good. It's all good. So here we are, the Travel Nurse Channel. We are here for anyone who travels, anyone who employs travelers, and all healthcare workers that travel. God bless you. Have a safe holiday. I hope you have whatever it is you want. If you just want to rest, I hope you get the rest you need. If you're having a work day, I hope it's a great work day. If you're taking the day off, I hope you have a beautiful day off. And pace yourself, because there's so many beautiful food and it's hard to avoid any of it. Do you want the sweet potatoes or the mashed potatoes? Have them both. Do you want the pecan pie or the apple pie or the pumpkin pie? Have a little piece of each. Anyway, so have a wonderful time. We are fortunate to be here. We have much to be grateful for. We're working on the things that don't work. And I wish you the very, very best. And I will see you not next week, because I'm having my hip replaced, but probably 2 weeks after. So I'll see you in December. I promise I'm lining up some great guests and a lot of authors, but I still want to talk to recruiters. I still want to talk to nurses that are considering traveling. I still want to talk to nurses that do travel. And we all want to hear from you. Want to hear what you're grateful for, what bones you want to pick, what you've learned along the way. Share, please share. And I think I'm going to sign off with my fun little commercial. And if I've missed anybody's comments, I apologize. I had the comment line open, but I get it. Busy, getting busier all the time. Take good care of yourself, and I'll see you soon.
Travel nursing can bring you to places you've never been before. Tell us your story.